And I think what's so concerning now, though, of course, for someone like you, it shouldn't be all too surprising considering the work you've been doing for the last several decades, but um, just seeing what's being called the abortion abolition movement, I guess, where they actually like these really just like they call them marginal, but they're actually involved in pushing certain bills through state legislators. And I think one in Oklahoma like almost made it through. And that is the actual not they don't want abortion to just be illegal, which is bad enough. And you just talked about some of the ways that that's been bad, even worse for people in already very vulnerable and precarious situations who the criminal justice system or the criminal injustice system is already targeting. But the idea of actually prosecuting people who get abortions in various ways. And this is becoming a real possibility to the point where, this might sound extreme to some, but I mean, the New York Times was even talking about this, how like in certain states, if they can relabel abortion as actual homicide, those states that have death penalties for homicide, you could actually see a situation where somebody is being prosecuted and facing potential death penalty for getting an abortion if they are able to be prosecuted in those states. So can you talk about the real danger here? Because this anti-abortion movement, which is like a generous term to use, I think, for what it actually is, isn't interested in just stopping here where it's already bad enough. They want to go much further.
I think that's absolutely right. And again, I just want to point out that prosecutions of people for either self-managed abortions or what are perceived to be unauthorized abortions has been ongoing. And groups like the National Advocates for Pregnant Women and If, When, How, and Sister Reach and many others have been documenting those prosecutions. They haven't happened necessarily under laws specifically criminalizing abortion, but they have happened under laws, either child endangerment laws or any law really, like concealing remains or not reporting a death or unauthorized use of medication or prescriptions or and I think that goes to thinking about what the process of criminalization is, which is basically deciding who's going to be targeted for punishment by the state, and then kind of any law will do, right? There's many laws out there that can be deployed to that purpose. I think the world became aware of that when Purvi Shah was prosecuted in Indiana under Mike Pence for unfavorable termination of a pregnancy, which they decided was an unauthorized abortion, and prosecuted her. And only thanks to organizing around that was that prosecution brought to light. But there's hundreds of pregnant people who have been prosecuted around theories of self-managed abortion or unfavorable end to pregnancy or drug use during pregnancy, which led to loss of pregnancy for a long time. So it's a danger that's definitely escalating, but it's one that has existed. And I think you're absolutely right that this is part of a much larger agenda that is about denying sexual, reproductive, and gender autonomy and exercising control over sexuality, all aspects of reproduction and reproductive health, and enforcing patriarchy, right? And we're seeing that in the ways that just today, many laws went into, or this past week, many laws went into effect around controlling people's sexuality or ability to discuss sexuality or ability to say gay or queer or trans. And certainly we're seeing that in the denial of and criminalization of gender-affirming care to trans youth and adults across the country. And all those things are connected. And that's one of the points that we've been making at Interrupting Criminalization through a couple of resources that we've released recently, to be like, listen, it's not like the fight for abortion care is different from the fight for gender-affirming care. They're the same fight. And because the right is seeing them as the same fight to control our reproductive, sexual, and gender autonomy, we need to see them as the same fight and not engage in this transphobic, thing that cis women are engaged in right now, where they're saying, oh, we have to focus on this and not that, and focusing on trans folks and trans healthcare somehow detracts from our struggle, which it's actually the same struggle. And the sooner we figure that out, the stronger we're going to be in resistance, and the less we're going to fall into the traps that the right is laying for us in order to advance their agenda. So and it's also, you know, part of their 30, 40, 50-year plan to bring about a society that looks very different from the one that abolitionists are trying to bring about. So I hate that they're co-opting the term abolitionist for what they're doing.